Hi, I'm Jack Shepard. Welcome to the first episode of my video blog, Briarpatch, down in dementia land. Today I'm going to talk about something really important and something that probably represents my biggest mistake uh, in being a caregiver, and that has to do with living wills. Uh, a living will is something that probably everybody should have, but especially if you're older or in poor health, and it's especially important to do it while the patient still has their faculties about them and can make decisions for themselves. If I would have had this, I would have taken care of it. It's called 5 Wishes. Um, it's essentially an advanced directive, but it's all set up. It's the important things are already there. You get the mechanics of it. You get advice, and it's just wonderful. And I want to tell you about it and just briefly go over it with you, and maybe tell you where you can get them and encourage you to do one for yourself and for the other members of your family. What it does, the 5 wishes are simple declarative statements, and it will say like 5, or I'll go through them. My wish for the person I want to make decisions for me when I can't, the kind of medical treatment I want or don't want, how comfortable I want to be, how I want people to treat me, what I want my loved ones to know. So it does an outline for you. You come to wish 1, the person I want to make healthcare decisions for me when I can't make them for myself. What it does for you is that it shows you a way to document who you want to be your care agent. They call it your healthcare agent, which is sort of the medical, proxy, or medical power of attorney is another word for it. But it has a form here you can fill out who you want, your first choice, your second choice, and then get their contact information on there. But even more useful is there's advice on how to pick a healthcare agent. Not everyone can be a good agent. You need to be fairly aggressive. You need someone who's going to stand up for you. You need someone who's going to push back on doctors. You need them, sometimes they don't do what they're supposed to do. Why this makes it easy is we have several statements here that have to do with making healthcare decisions. And there's statements like, move me to another state to get the care I need or to carry out my wishes. Authorize or refuse to authorize any medication or procedure needed to help with pain. It has a bunch of things like that, and the patient or the person who is creating the 5 wish statement can cross out the ones they don't agree with, and there's space to add additional ones down here on topics having to do with the person who's going to be making your healthcare decisions. Bottom, it's what to do if you change your mind. How do you cancel one of these? The second wish states, my wish for the kind of medical treatment I want or don't want. And then it says what you should keep in mind as my caregiver. Again, there's some declarative statements, and if you don't agree with them, you cross them out. So in this case would be stuff like, I want to be offered food and fluids by the mouth and kept warm and clean. So we have all these scenarios. What happens close to death? Here's stuff that you may want to do or not to do. If you have a coma, if you're going to coma, if you suffer brain damage or other conditions, and it's all right here. I mean, you don't have to sit there with the patient and think of eventualities that might happen, because the 5 wishes people have taken care of it for you. The rest of the wishes are pretty much the same way. You just agree or disagree with the statements. Which states require notarization, and tells you how to do the witnesses, who can be a witness to your signing or not be a witness. So it's kind of like it's a legal document. It tells you what to do when it's signed, where to keep it, who to distribute copies to, and even there's a way to make, they have a little thing in here you can make a wallet card to notify emergency personnel or medical personnel that one of these living wills, 5 wishes living wills, exist and that they should find it. I obtained my copy from our local hospital, and hospice are a good place to look. Your doctor's office may be able to supply you with them, and it's just a wonderful thing. What happened sort of in our recent crisis was that BJ a couple weeks ago stopped eating, stopped smoking. He's a smoker, unfortunately, and took to his bed. Um, he's getting into end stage dementia now, and the doctors are telling me stuff like, if perhaps should BJ, catch the flu this winter, maybe you should think about not treating it and letting him go. Apparently, pneumonia and respiratory diseases are one of the primary ways that Alzheimer's patients and dementia patients leave the earth, and they tell me that's probably the optimal way. So the weird situation you find yourself in if you don't have one of these would be like last Tuesday, where I have a man here that looks, sick, and they're going, they're saying, well, maybe you shouldn't treat him. So I'm thinking, well, should I call the doctor? Should I not do anything? Should I just keep him comfortable? Um, uh, what should I do? What's the right thing to do? And then I figured out the right thing to do is what the patient would want. But unfortunately, the patient is too mentally incapacitated, like not just at that moment when he was sick, but prior to that. In the past year when we went through the failed hip replacement surgery last year, he became just too disorganized and too demented to make decisions or even to focus on making a decision about health care when you're unable to make a decision about what kind of sandwich you want for lunch. It's just something you can't even bring the subject up to the patient when they're this far gone. And so is anyone who's ever had to put a pet to sleep or something, how difficult that is. If you could just imagine having a loved one laying there and then wanting to do something, but then in the back of your mind having doctors and professionals saying, this would be a good way for him to go, is just mind-boggling. So I don't want that to happen to you. It's terrible. I don't want it to happen to anybody, and it doesn't have to, because all you have to do now is get the 5 wishes. Such a thing as a good death, and there's a bad death. And I think we all want, for our loved ones and for ourselves, to have a gentle passing from this earth, and the 5 wishes can help us do that, not just for the patient's sake, but probably more for the loved ones and the caregiver's sake, so that we don't have to be second guessing ourselves. So if you are a caregiver, do it before it's too late, and do it for yourself too. That's all for today. I made it through another episode. I hope you'll join me again. This is Jack saying, be good and grow.